I'm joined by Kelvin Mackenzie, former editor of The Sun, and somebody who's spoken out quite strongly on these strikes. It is considered a basic human right for people to be able to withdraw their labour. And we understand that. We might not like strikes, but we understand that. And, hey, strikes have been around since pretty much Tudor times. I think we've known them in this country on and off. Do you think that the government is right to try and legislate for a minimum level of service on vital sectors? Or would you go further and say that strikes should not be allowed at all?
That's where I'd go. For something like the ambulance workers, and incredibly, it's astonishing, the 999 call handlers are now on strike, or have been going on strike in 6-hour blocks, actually. They decided very kindly, that's very nice of you, so nice of you, not to do it for 24 hours. So, and then the management get involved in this and then beg the public, look, unless you are literally going to die or your relatives think you're going to die, please don't call us. Try and get somebody to take you by car. Do you know what I find extraordinary about this? That our country is so inured to the actions of public sector workers to damaging and destroying their lives that they just say, oh, well, that's it. I don't feel like that. I think it's a shocking thing to think, and I say this over and over again, the idea that your dear old mum falls over, shatters her hip, and that you and your relatives or your friends or your neighbours have to work out a way to, because she's not, I think it's category 1 now, she's not in category 2 or category 3, to work out a way that you take her to A&E while she's screaming in pain.
Kelvin, I'm going to stop you there. I'm going to go to Matt Taylor, paramedic, who we now do have on the line. Matt, good evening.
Good evening, Nigel. Can you hear me now?
Matt, the argument that is being put here in the studio by Kelvin Mackenzie, which I rather agree with, is, we are law-abiding taxpayers in this country, and if our elderly mother, falls to the floor and is at risk of losing her life, surely she deserves an ambulance to come to her.
She certainly does. So does everybody, not just the gentleman's mum. Let's give some context to the conversation, shall we, and give some backstory for the general public so they can understand why we're in the situation that we're in. During 2021, when we dismissed 40,000 care workers because they didn't necessarily agree with the current mandates that were being pushed on them, we lost 40,000 care workers in care homes and domiciliary care, which means care in the community for looking after your relatives when they get discharged from hospital. Now, if you have hospital beds that are full in hospital and with patients ready for discharge, if there are no carers in the community to look after these patients, they can't be discharged from the wards. If they can't be discharged from the wards, there's no beds for them to be moved to from the A&E department downstairs. As a result of that, no beds in A&E get available or become free. Therefore, the ambulances can't offload the patients, which creates a queue. Therefore, those ambulances get stuck at hospital, can't discharge, can't offload the patients, and can't go back out to pick up more patients. So, as a general rule of thumb, that creates a shortage of ambulance.
Matt, hang on a second. Matt, bear with me. On those 40,000 care workers, I've campaigned on this programme to say it's completely wrong and they should have the option of getting their jobs back. All right, and I really have, very, very strongly. On your general comments about the current failings of the NHS, the 13,000 people in beds that don't need to be there, all of those things, ambulances arriving, A&E not able to take patients. I get all of that. I'm with you. I understand the problem. I believe the NHS is broken and needs a rethink. However, the point that I'm making is surely the government is right to say that we need legislation with ambulances, for example, and nurses and doctors to say that a minimum level of service will be guaranteed. Surely that is the right thing to do, and I would argue even the compassionate thing to do.
It is guaranteed. Everybody that was on strike, was on the picket line, was still available for Cat 1 calls if required, or the people that were on the picket line were off shift. Never has there been an ambulance station completely unmanned so that when calls are coming in, there is no one to respond. And I want to point out the last strike that happened with the ambulance crew was one of the quietest times, one of the quietest days in recent months. So the general public were well aware of what was going on, and the demand for calls went down. So it would have been one of the quietest 24-hour periods in a long time. So I get what you're saying, Nigel, I really do. But what I don't appreciate, and lots of other care workers and health professionals don't appreciate, is other people who don't work in care deciding and discussing what it is they think will work in a care environment. Now, I will give an opportunity for any healthcare professional, MP, members of parliament, anyone, to come on an ambulance for 12 hours and work in A&E for 12 hours and then come out with the same opinions of what they had when they went in. And I appreciate that the general public aren't always aware of what's going on, and they're only told things through rose-tinted glasses to trigger or to sway with whatever party narratives they want to push at the time. No one ever really sits and talks to the people that work on the front line, right. Boots on the ground.
So Matt, basically, you want more money, but you're arguing. Just give me a quick answer to this. You're arguing that actually,
money,
even though
never said nothing about money.
All right. Well, strikes across the public sector are generally about money.
Okay, listen. What the problem we have at the moment is the unions, unfortunately, represent us in certain aspects. Now, I don't agree with the unions using the wage increase over the working conditions. Personally, and I know this from most staff, it's the working conditions that are more of an issue than the wage increase. The wage increase will just help with retention to stop people leaving, which would make the situation even worse, which is what we're trying to prevent at the moment. Now, the fact that none of the people wanted to sit down and discuss anything for weeks on end, that's not our problem either. Only 50% of people voted out of all the healthcare professionals. Only 50% of people voted to strike. So another 50% of people either didn't vote or were too scared to vote. Now, I know lots of people are too afraid to really speak up and talk about the situations and things they are seeing frontline. This has been going on for a long time, Nigel, right? But those of us that work in NHS, this is normal. The problem we've got now is the ambulances are being stuck at A&E, so they can't be discharged. There's always been delays for patients, unfortunately. We don't code them, but there are always been delays for patients. Unfortunately, that's not our fault. The system gets abused. Sometimes the triaging of calls isn't as accurate as it could be. There's a plethora of reasons why. But no one is sitting there saying, I'm striking, so I'm not going to respond. That is not happening. And the main priority for us
listen, you've made that point. Matt, you've made the points with great passion. Thank you for coming on the line. I'm pleased we got you on the line. Well, Kelvin, it was difficult to disagree with his analysis.
Yeah, but hold on a second. I agree that there are conditions. Yeah. These are exceptional times. The NHS has turned out to be completely useless. And
well, no. We all clapped it 2 years ago. Yeah, the envy of the world.
Yeah. Well, what should we do now? If we're going to be driven by emotions in relation to the NHS, perhaps we should all boo it now at 7 o'clock. I mean, that is the reality of it. What he didn't address, and by the way, that was quite an interesting response. What he was basically saying is we don't want the money, we want conditions, right? Well, that also...
But he wasn't a union representative.
He wasn't a union and I reckon he will get an absolute bucket load for that. So thank you very much indeed, Matt, for that. But he didn't deal with the issue that this time 999 call handlers came in. He didn't deal with the issue that only if you were literally very, very ill, right, literally on death's door, was an ambulance going to turn out. Yeah. So that's a change. And they have said, both Unison and Unite, that this is the start of a long campaign. Well, how much worse is it going to get? Is it next time Category 1? Is it next time a bomb goes off in Manchester? Nobody turns out.
How political is this?
I think for the trade union leaders, this is a matter of this. They are now in a situation where they're lefties, and they may well be lefties themselves. I mean, some shockers. I mean, the guy who runs the Fire Brigades Union. Oh my God! If you looked at his background, young socialist, and then finally he gives it up.
It's back to the 70s, isn't it?
It is the 70s, and they're enjoying it. Why? Because somebody's listening to them for the first time. The amount of trade unionism in our country is obviously collapsed over years. I'm old enough to remember Harold Wilson saying to Jack Jones and Hugh Scanlon, "Get your tanks off my lawn." And that is the situation, I think, that Rishi... Rishi has got a bumpy ride. I admire the fact he's brought this in. I don't admire the circumstances he should have done it when actually... there was none of this going on.
But today he pretty much got it right in your view.
He was brilliant today. He punched out Keir Starmer on a very difficult wicket.
Kelvin McKenzie, as ever. Well, guys, it's a very, very powerful, emotive debate around essential public services. But I too think today the Prime Minister got it right. Very often I don't think that.